going to hear from Justin Bates, who's going to focus down the story a little bit and offer us suggestions at how the pharmacy business can help address some of these problems. Oh, and before Justin comes out here, come on. A full disclosure, I am the president of an advocacy association called CARP. We look after the interests of Canadians as they age, and it is CARP's view that some of the rising costs of which everyone is concerned can be addressed by devolving more and more operations out of the doctor's office and into the pharmacy. And we're also of the view, this is on the public record, that the best way to dispense medical marijuana in Canada is through pharmacies, because it's pharmacies who know what other drugs patients are on and have the professional capacity to offer advice as to the appropriate strains and so on. So that's CARP's position.
So thank you for the introduction. It's great to be here. I was told, though, that I have to be a contrarian to Dominic's position, just to mix things up and get people interactive. But of course, I'm not going to do that, because I think that the real jumping off point from transitioning from what Dominic talked about at a macro level with respect to healthcare is really talking about the piece around patients and how patients are at the center of all of what we do in healthcare. And whether you're in the system in a variety of different capacities delivering healthcare, it really does have to be centered around what's in the best interest of the patient. I've been advocating for pharmacy's role in healthcare for almost 15 years now. Prior to that, I spent over 10 years in the insurance side, better understanding how to pay for these types of services. But I really didn't understand the perspective of the patient until my wife was diagnosed with cancer this time last year. And I was able to really navigate as a patient advocate, her advocate, through the system with 4 kids, trying to better understand what are the therapy and treatment options. It was a real firsthand look at what's good about our system, but also where some of those challenges are. As a representative of pharmacies, we look at it from the perspective of creating capacity in the system. We represent a number of different stakeholders within our advocacy association. We're in fact the only not-for-profit trade association that represents the entire pharmacy ecosystem through the delivery of care in the community with over 10,000 neighborhood pharmacies, points of care throughout the country, but also the varying evolving patient care models. When we look at shifting and transferring care from costly institutions into the community for specialized treatments and biologics, but also in long-term care facilities where pharmacy plays an enhanced role, and looking at it from a convenience standpoint. We have an untapped potential with pharmacy with respect to the convenience and the access the patients have in all the communities where they live, work, and play. And it's really about how do we tap into the expertise of those heroes that Dominic mentioned with respect to the frontline healthcare providers, the pharmacists that are in those communities and have the expertise to be able to provide care at a level that is certainly personalized as well as very clinically focused. We look at it from an advocacy perspective and talking to a variety of governments, both at the provincial and federal level, as the 3 Ps. We look at it first and foremost from a patient perspective. How can we enhance care in the community for patients and help them manage their conditions better? We look at it from a payer perspective, efficiencies, savings, and innovation that we can bring to healthcare through our member organizations. And we also look at it from the perspective of pharmacy. So what are the solutions that we can bring to government to help shape health policy, drive towards the sustainability of the system, which we all know is challenged in every jurisdiction, but ultimately we need to be on the solution side and advancing policies that work for the population. Now, you might be wondering from this graphic, what learnings can we take from McDonald's? And really, it's a bit of an abstract, unconventional approach. But years and years ago, the CEO of McDonald's stood up in a crowd much like this, and he asked the audience, "What business am I in?" Predictably, most of the audience members said fast food, restaurant business. And he paused and he said, "I'm not in any of those businesses. The business that McDonald's is in is marketing. So you might ask yourself, how does that translate to healthcare? Well, when I think of pharmacy, and I think of our member organizations that have excellence in care in the community, we're really about making people's lives better. We're helping people who are trying to cope with a recent diagnosis. We're bringing people into the circle of care and connecting them with all the different healthcare providers and providing critical advice at a time when people need help and they need access to services. And that's really where positioning pharmacy as a vital partner in the delivery of care is our opportunity as we move forward. We see it in 3 different areas. The first is in primary care. Lots of opportunity for access to primary care services, that we give pharmacists more ability and scope to deliver those services in the community. Things like minor ailments prescribing for things like pink eye, cold sores, where traditionally people would have to wait several weeks in some cases to access that service through a GP. Many people, even in the province of Ontario, and even more closely here to the city of Toronto, still do not have access to a family physician. I mean, that in and of itself, when we talk about healthcare being a pillar of what makes us Canadian, should be unacceptable. We have the opportunity through our publicly funded system to do better, but if we're not maximizing the scope and the expertise of the healthcare providers like pharmacists, we're missing that opportunity. And it's really not about working against or pointing fingers in the system. It's, in our view, about bringing those parties together to enhance the interprofessional collaboration and reallocate the resources effectively. There's no hospital bed that's going to go unused. There's no doctor's office that won't have a patient in it. What you want is the right patient in the hospital getting the care they need and the right patient in front of the GP. Those patients that can be served in the community should be through a pharmacy where we have the 10,000 points of care across the country. We talked a little bit about drug optimization, medication management. Really what that means is we want to optimize the therapy and the outcomes. We have lots of expertise to be able to ensure that patients are adherent to medications, but also to look at all of the clinical safeguards and safety that comes with that. We have sophisticated technology and innovation in pharmacies to deliver optimal outcomes and care, and we want to be able to maximize that. And then lastly, Dominic talked about the example of vaccinations, and there's probably no better example of how community pharmacy plays a significant role in the community when you look at the immunization rates for the influenza vaccine, but we have more we can do, and certainly within the scope to deliver publicly funded vaccinations for things like pneumonia, the shingles vaccine. There's a host of opportunities to deliver those immunizations where patients are already comfortable and have the convenience to access their healthcare provider. All of this is happening in the backdrop of significant pressures in the healthcare system. We know that there's deflationary pressures across the healthcare industry. There's been a number of challenges related to the whole reimbursement model for pharmacy. And what you're seeing, and you likely see it as you visit your neighborhood pharmacy, wherever you may reside, but you're seeing a transformation within the stores that are delivering the care, which really is the embracing and harnessing of that clinical expertise with the pharmacist to have more of that interaction and consultations with patients one-on-one. Medication management, dispensing activities related to product will always be part of our core service. But where the opportunity is in the change management infrastructure and innovation that's supporting this transformation is more into a service level. It's ongoing monitoring of patients. It's that ability to be a resource within your community for all kinds of different conditions. And that shift is going to happen over time as we put in place the appropriate incentives and have a model that facilitates and fosters that transformation from drug distribution into services. We're also getting into a lot of value-based initiatives around how do we ensure we're measuring the quality and the outcomes that come with the services that are being delivered. And we're working with all kinds of payers, both on the private side, insurance, and also on the public side, to ensure that we're measuring our success and monitoring patients appropriately. At the end of the day, we need to make sure that we break down the silos. I think if there's been any challenge with healthcare, it continues to be that Pharmacy generally is paid out of the drug budget. You have primary care budget that pays hospitals and GPs. And there's a disincentive from a government perspective, frankly, to achieve savings that would accrue across the different budgets. If you're managing a budget and your line items are within drugs, you're not getting rewarded, if you will, or compensated based on savings that may accrue to the hospital budget. So we need to find a way to break down those barriers and silos so that we're encouraging and incentivizing healthcare providers not only to work together and collaborate with respect to patient care, but also from a payment model, we need to make sure that we're recognizing that those benefits won't be just in pharmacy, but if you're keeping people out of hospitals, if you're keeping them out of GP offices, there are efficiencies and savings that are gained, particularly of avoiding things like adverse drug events and drug-to-drug interactions where pharmacists play an integral role. So with all of this roller coaster of change that's happening, budgets that are compressing, changes the way pharmacists are being compensated, we try to look at it from the perspective of the 3 Rs. So we want to make sure that pharmacy remains relevant, that we have programs in the community that address the healthcare needs of the patient population. We also need to better harness the power of the relationship. Very much so in healthcare, when you have a diagnosis, something as severe as cancer or common as diaper rash, you really rely on and depend on that trusted relationship you have with a pharmacist. That relationship is what we're trying to leverage in the trust that Canadians have and have demonstrated over time they have in their healthcare providers, particularly pharmacists. And then measuring those results and being able to continually monitor the patient throughout the life cycle of their condition. We developed, in concert with the Ontario Pharmacists Association, something called the Pharmacist Care Platform in the recent Ontario election, something that we're using as a blueprint across the country. And in that, we highlighted that 94% of Canadians think favorably of their pharmacists, more than any other healthcare provider. We want to make sure that as part of our platform, we have positive solutions that address some of the issues that we've all read about, hallway medicine, the capacity issues, and leverage and harness the high accessibility of pharmacies. And ultimately, we want to make sure that we position ourselves as a solution with real, tangible services that patients can access. So when we look at our 4 key areas that we have provided proposals to the government across the country, it really comes down to enabling more scope of practice, so pharmacists doing more, leveraging their education and expertise in areas around prescribing, prescribing for common ailments, as well as expanding the ability to do more injectables and immunizations. Another growth area for accessing services is something called point-of-care testing. You think about rapid HIV testing, strep, testing for strep. Those types of things provide timely access to care. They're as accurate as going through lab, and they expedite the treatment options. And those can be critical in terms of bringing people back to work, healthy and productive, or back home, and mitigating some of the potential external challenges when people are sick. Also, we have been very much involved in the advocacy around cannabis. There is an opportunity to ensure that patients that today receive medicinal cannabis do so through the circle of care that they enjoy with every other medication, and that is having pharmacies involved in the role of dispensing and distribution of medicinal cannabis, where there's evidence, and there is a growing body of evidence that supports medicinal cannabis for a number of different indications and conditions. But right now, those patients are getting those medications through direct with the licensed producer, and they are not afforded the same safeguards that folks on any other medication would receive. And there are potentially serious side effects, drug-to-drug interactions that can occur with medicinal cannabis. And there's obviously an overall treatment plan that needs to be considered when a patient looks at medicinal cannabis, potentially as a secondary or tertiary treatment option in the areas of pain particularly. Point-of-care testing, this just demonstrates some of the potential savings that can be driven towards payers, whether that's private or public, but in most cases through the public plans, the government-sponsored drug programs. So there's a tremendous amount of potential for savings as it relates to enabling more of these tests in the community. Certainly in minor ailments prescribing, there is pockets of it available. In Alberta, for example, pharmacists can prescribe just about any medication that's not a controlled substance. And we've seen significant savings and efficiencies in Saskatchewan from pharmacists providing common ailments prescribing and assessments. So it doesn't always tie to a prescription. Sometimes it's an assessment, and it can result in a number of different treatment options. So with all of this disruption that's being faced, there is an important role that pharmacy has in the community. We certainly are a driver of economic growth, both in the provinces and pan-Canadian. As a percent of GDP, the number of jobs that are generated through pharmacy, we have a tremendous economic footprint and a positive role that's played within neighborhoods across the country. And that's the story about pharmacy. You know, we're not just a store, we're an access point, a healthcare hub, even a triage for many of the patients who use these services and rely on that relationship, that trusted relationship they have with their pharmacist. One of the areas that we're really, I think, play a potentially greater role is with the growing crisis around the opioid epidemic, particularly as it results in a number of dependencies. In Ontario alone, we have 5 new opioid dependencies every year. And over a 5-year span, every day, sorry, 5 people become addicted to an opioid every day in this province alone. Over a 5-year period, that will fill BMO Stadium in Toronto. So the scope of the problem is certainly grave, and it's not getting better. In fact, it's getting worse. There was over 4,000 deaths reported last year from opioid overdoses. So from a pharmacy perspective, we want to provide more oversight, focusing on prevention, harm reduction, and also on education. There's much more we can do to help contribute a solution to what is really an unacceptable plight when you look at the numbers and the trends. And that's where we can leverage some of the expertise of pharmacists, and we can do more to help patients. The last topic I wanted to talk about was certainly national pharmacare is on the radar, both in the media, public and political discourse. And I think it's important to point out that when you look at where the gaps are in the system today, there is a number of, majority of Canadians have coverage either through their public plans or through private plans. And we want to make sure that we're driving towards a solution that fills the gaps of care and achieves the principle of equitable access to medicines. All Canadians should have equal access to medicines that are affordable. And we believe that we can do that within the current system of a public-private mix of coverage. We're advancing a solution that's positive. It's about patients. It's an alternative to the universal first payer system. But what it will do is ensure that every Canadian has access to their medicines, and that we have a national, very similar to the CPP-funded type program, catastrophic drug coverage for those higher cost, high complexity patients, and also a common formulary so that all Canadians have access to the same number and type of drugs in all of the provinces. So with that, I will conclude by saying that there is a bright future. There are solutions, even though there are challenges with the budgets and fiscal sustainability in each province. There are opportunities working with healthcare providers and pharmacy to drive better care in the community. So thank you very much. Thank you.
The arguments made on this stage seem to me so eminently reasonable. Can you explain what the resistance is?
Well, I think it's partly demonstrating the value, so through research and evidence, and also to generate the support through grassroots activities, having patients tell the stories, patient groups talk to healthcare decision makers, whether that's in government or on the private side, and building the awareness and creating the solutions. And that's all part of what we're doing to essentially have a plug-and-play solution to what ails our healthcare system. But there needs to be a political will and appetite to make investments in certain areas of healthcare that aren't all public, some of it's private, but that has a clear line of sight into a return on investment.
Well, I hope some of those policymakers have been looking in on our conference and listening to your talk. Thank you very much.
Thank you.
Let's give it a shot.
Yep.
Okay. All right.